Well, one of the things that happened as a result of the Affordable Care Act that I think was very surprising for a lot of people who were waiting to get coverage, they expected they would be under some sort of private system, there'd be a subsidy, everything would work out in sort of a private care system, and they were shocked to find that their options were going to be an expanded Medicaid program. Now, there have been problems with Medicaid over the years. We now have more people having to use that option. How is it for the kinds of things we're talking about? Healthcare in general, mental health care in particular, are the reimbursement rates adequate? Are people going to get the sort of care we would hope they would have if they're in Medicaid or on the extended Medicare program? You deal with that probably more than anybody.
Yeah, so the Affordable Care Act has been just an absolutely fascinating change to go through, and we're not through it yet. About a third of our practice had the county health plan, Washtenaw Health Plan. So, by September, that's going to be about 20% of the size it was as of January 1. So, we're having a lot of patients really having their coverage shaken up. Some of them love it, right? The guy who gets Blue Care Network through the exchange for $25 a month to get the what is it? Platinum, I think. He loves it. And then you get the person who's getting the big deductibles and you don't see them much. Actually, we've had people disappear. So I tell you, as we went into this year, we made all these projections that life was going to be great, and then some subgroup of people got sticker shock, and that was not something I expected. I think one generalization it's very safe to live by is that standard Medicaid, doesn't cover the cost of providing the care in most instances, and certainly when you start dealing with Medicaid, with the mental health system, it's extraordinarily overloaded. And services are hard to get. It's kind of get in line. If you can find someone, then you get in line. So access has always been a problem. That's actually, we're, Julie Walden really, I would say, is the architect of the Packard Integrated Health Program. And I can tell you that's part of the response. That's partly why. It's just the system was so overloaded. So in primary care, at times, I'll be honest, you felt a little trapped, right? You were here with people who are more complex than you could really deal with, and you needed some help, and Julie and Kathy Robinson really made it happen at Packard, I think, for a lot of people's benefit. But yeah, it's safe to say that the system's overloaded.
So if our hypothetical 24-year-old mom with 2 little kids and a fairly deep depression is on Medicaid, what happens then? She doesn't have nice health coverage. She can't go to her U of M doc and get handed off to another professional within the system. What happens to her now if she's on Medicaid?
I think if she's in a standard practice, they will try to refer her and she'll queue up. And then you'll have a primary care doc, and primary care docs write probably 80% of all antidepressants in the country. So they're really providing the bulk of the depression care, and then they'll do the best they can given the limitations of the system. I would argue that's part of why integrated health programs are a superior model, because you avoid that delay where either people don't go from either system to the other, or they go and they get into this queue and there's this big lag in receiving services.
I don't think they can net psychiatrist or primary care doc to handle the load.
Yeah.
That's the problem. And if you look at the average medical student, they're graduating something like $230,000, $240,000 debt when they graduate. They're, for obvious reasons, picking specialties to pay more. And so I think part of the problem is they're just not enough of us. All these people come in and we are overloaded. And so when I call, even through MDOC, you try to get a psychiatrist, it's very hard.
And of course, most of the people in the room, that's where they rub up against the system. That's where they're finding the difficulties.